Hey everyone, welcome to another night on call in urology. So it's going to be citywide call, which means that there's 4 hospitals that we need to cover. So as a junior, I'm not yet expected to be in the operating room. So I'm more going to see patients in the emergency, patients on the ward that need urgent consults. Because it's citywide and we're covering all these hospitals, it does get pretty busy. Even if you just have a few calls, the time to get between the places does take up a bit of time from your night. And hopefully there's going to be things interesting tonight and I'll take you guys along. So welcome to a night on call in surgery. Hi, so if this patient has one of the most common penile implants and you said there was a pump in the scrotum, there should be a little button just above the main pump that releases the pressure. So the pump is kind of this little ball, but just above that, it's a bit flatter and there's a button in the middle of it. Nothing's coming out. This patient came after surgery, non-related to urology, but he has a penile implant. And so I've been looking up penile implants for the past 15 minutes, looking at different options and what can go wrong. I'm not really sure how to help if they can deflate it. Luckily, I looked up online how to deflate this and I asked the doctors in the ICU to just press the valve to release the pressure, but also squeeze the penis where there's the water inside so that the water can go back into the reservoir and not be in constant state of erection. And luckily this worked, so we didn't have to do anything more. This is E4, so it's the ward at the hospital I'm not currently at, but I have a little paper here that has information for all the patients that are there and things to look out for, so hopefully that can be helpful if it's something that I'm not sure about because I don't know the patient. So it looks like I'm going to have to go into the hospital just to correct a prescription. We got a call saying that the pharmacy couldn't accept one of the prescriptions for the pain medications for one of our patients, and unfortunately, we do have to go in and write that ourselves. We can't just do it over the phone. So obviously it sounds kind of dumb to have to go into the hospital just to correct a prescription. But if I was in hospital, it'd be much easier. You just go down there and write it. It's no big deal. And that's, I guess, the pros and cons of a home call. I get to be at home, but if there's something a little bit minor that to go in for, then it just seems a bit more inconvenient than if I was in the hospital. But whatever, we'll just get it done. And we're back. So I'm just gonna chill at home in my office, probably study a little, look up some things online, and then see if I get any other pages, and then update my senior resident when he goes out of the operating room in maybe about an hour. So I just got off the phone with my senior resident who's been in a case for about 2.5 hours. It was a kidney transplant, which happens kind of unpredictably. There is another case going on tonight. And so when he's in there, it's tough for me to reach him, but I didn't have any burning questions, but we did have the time to update each other, and he told me what was going on, and I told him about the calls I got and things I was unsure about, but fortunately this time there's no new consults or nothing I needed to run by him, but he always just checks in to make sure that I don't have any questions, especially that I'm not a urology resident and I'm in my second block, so I really don't know everything, especially not urology related, and I always run things by the senior resident, and in the first few months especially, they are very nice and welcoming for first years because they know that I guess they were in the same position not too long ago, and they're always willing to help out and make sure that we're never left in a position where we're uncertain of things. So that's where we're at for tonight. Nothing new, and we'll see in a few hours. So I just got a call from one of our nurses on the ward asking about one of our patients who underwent a while ago a Mitrofanov procedure. So what they do is take the appendix and use that as a track to connect the bladder to the outside of the body. And usually they'll hide it kind of at the belly button so that it's inconspicuous, and it won't empty on its own because of the way it's attached. But the patient can self-catheterize, which means they put a little tube in every few hours to empty the bladder, just like that. It's kind of a cool way to bypass the urethra. And that's something I learned this week. So on dovetail, yeah. Okay. I'll go in and I guess try to figure it out. I'll give you a call when I see the patient. So there's a patient that I need to see. It's at a hospital that I haven't been at yet in this rotation. So part of it is gonna be getting lost in the hospital and finding the emergency room. But this patient sounds like something that we might need to admit. We'll go have a look. Took me way longer than it should have just because I didn't know how to use the electronic medical record. Everything here is computerized, so there's nothing written on paper. It's completely digital using the system called Epic. And honestly, we had training on it for 3 hours a few weeks ago, but since I haven't been to this hospital, I haven't been able to practice. So yeah, that was a new experience. The computer system was, it's good. It's just not the time to start learning about it. Definitely a new challenge, but got it done. So I am definitely not home. I'm actually at another hospital now because there's a new consult in the emergency room that needs to be seen and probably be admitted. So hopefully I can do this pretty fast and go back home. So I just made it back. It's about 2:30. So I have to wake up at around 5:30 to go round on patients. So gonna get some sleep now, and I think that's it for my night. So it's about 5:45 in the morning now, and I'm back at the hospital to round up the weekend team. I want to thank you guys for watching. I hope that this was entertaining and that gave you a little bit of insight into what a night on call can be like when you're covering citywide. I'll see you guys in the next one. Bye.